Good afternoon. I'm Kim Elizabeth, and this is Aleesia Isom.
Yes.
And she is with
The Fit Pelvis.
And we are in Sherman, Texas. And Alesia's going to tell us all about what she does and why it's so special. She is a physical therapist, and she helps women with all kinds of pelvic symptoms, yes. All the things that we go throughout the different stages in our lives, right?
Yes. Yeah.
And she'll tell you all about where you can find her, where else she works, and let's go.
Yes.
Okay, so how long have you been here in Sherman?
So we opened up our Sherman location last summer, so May 2023, so we've been here about over a year, and we're just growing and expanding, and it's been really exciting to provide these services for women in this community, and then continue to educate about what we do.
Okay, so how do people find you? Like, do they get a doctor's referral, or do they just look you up on Google and call you? How does that work?
So the cool thing is in Texas, physical therapists have something called direct access. And so you're able to see your physical therapist without going to a primary care doctor first, or without going to your OBGYN first. And so you can come directly to us, and then we'll work closely with your primary care, with your OB, to get a referral to sign up on our plan of cares. But yeah, so you can either come directly from Google search to find us, a friend referral that has seen us previously, or if you go to your doctor and you say, here are the things that I'm experiencing, if they say you need physical therapy, then they can refer you back to us. So there's many different ways that you can find us.
Okay, so I was a nurse for 30 years, and I've never heard of physical therapy for women's pelvic issues before. I mean, pain, of course.
Yep.
So how new is this type of therapy?
So it is pretty new, and it's growing and expanding over the last 5 to 10 years, and more people are starting to learn about it. And we're starting to get a new generation of women who are wanting better for their bodies, who are comfortable talking about some of their symptoms. So if they're having pelvic pain, if they're having bladder leaking when they cough or they sneeze, they'll tell their friends, they'll look on social media, and then they realize, oh, this isn't normal. It's very common, but it's not something that you have to live with the rest of your life. And so then they start seeking out help. So they're starting to Google that I have bladder leaking when I cough and sneeze, and then it's recommended to come to pelvic floor physical therapy. So yeah, the pelvic floor is the layer of muscles that sits underneath the pelvis. So it's the same as any other muscle within the body. It's just in a more intimate space that we can help women, so that way they don't have to suffer and be in pain or embarrassed with any of the symptoms.
So is that kind of like, Kegel exercises? Is that what they're exercising? Is that pelvic girdle area?
Mm-hmm. Yeah, so Kegels are pretty much the common treatment given for anything pelvic floor related, but we know through research and treatment that there is so much more that we can do, and treatment that is truly helpful and gets you better faster. So a lot of times Kegels are given to everybody, but they're only helpful for somebody who has a lot of pelvic weakness with their symptoms. And then most commonly what we find with women is that they actually have tension in a tight pelvic floor. So doing a squeeze, doing a Kegel could make symptoms worse.
Okay.
So we recommend coming to see us so we can do the evaluation to see actually what's going on with your pelvic floor. Sometimes it's not the pelvic floor that's giving the issue. Sometimes it's in your low back. Sometimes it's a muscle within your hip or your inner thighs, your core. So we look at the whole body, every muscle, every joint, every bone, every nerve, to make sure that everything is working the way that it needs to. And then we know and are specialized with how that connects into the pelvic floor.
Okay. So what about like after childbirth, when our muscles don't come back together? Yes. Is that something that you help people with too? What's that called?
Yes, absolutely, we can help. It's called diastasis recti abdominis, or ab separation.
Yes.
So when somebody is pregnant and the baby is growing in the belly, then the ribs and the abs need to separate a little bit to make room for the growing baby. And so then what we look for postpartum is to make sure there's core strength, to make sure that the abs are coming back together. We look to see, are you having any additional back pain, hip pain, pelvic pain, any bladder leaking, because that all can play together. It is all connected to the core of the body. So we do help with core.
Yeah, my daughter was doing some therapy for that. She has 4 children, and she was showing me some exercises, and she was like, "Mom, you can put your whole hand in your abdomen."
Yes.
And I was like, they just, the last time I had 5 kids, they just never came back together. So that's what she was doing therapy, was to get that back to hers, to come back together and get her all of that back where it should be.
Yes, and so that's what we like to do too, we like to educate. So educate of what's going on. So a little bit of separation is normal because it's 2 different sides of the body, and that they're coming together connected by connective tissue. But yes, so we measure the width, we measure the depth of that separation, we see if there's any pain, any risk for any hernias or any serious injuries, and then giving you exercise to progress, so that way you're able to do what you want to do. So if it's picking up your kids without any pain, if it's playing and running with your kid, or just carrying the groceries inside, then we're able to do those and give you those exercises that are specific to those tasks.
And then there's a guy that, I think he was in Texas, this was a few years ago, but he had this whole set of exercises where he teaches you to breathe and lower your, I called it your elevator. So you're pushing down into your pelvis. And I still do some of those exercises. I didn't do his whole thing, which I probably should have. But I still do some of those. And then when I know people that have pain in their lower back or something, I'll show them, look, if you do this and focus on pushing down into your pelvis, that really does help relieve pain. I mean, I know I'm not a physical therapist or a doctor, I'm a realtor, but sometimes people just, they don't know what to do at that moment. They're just feeling miserable.
Yes, and that's where we like to come in and start educating, and that's why we like doing educational classes and resources, so that way you can understand of when you are in pain, you know what to do and where to go. So yeah, we do look at breathing, so because it does play a good role within the pelvic floor. So if there's a lot of tension or weakness within pelvic floor, we need to make sure the rib cage is fully expanding, breathing through diaphragm. There's no restrictions within rib cage, no restrictions within abdomen. And so so some people can do those exercises of breathing, but then if they don't know if they're doing them right, if it's not helping, if sometimes people can have restrictions on one side versus the other, and then that's where our skill comes in to say, oh, this is how we can help, that's specific for you, here are the exercises that you need to get to full relief.
And usually what I see, well, even with myself, if it's working, you keep doing it, but if it's not, it's like, okay, that wasn't working. But probably it was just that they needed, that you need something different. You need someone to actually look at what's going on and say, oh, okay, you need to do this instead, not instead, but because this is going to help you feel better faster.
Yes, and to get better faster, because you can look online and find all of those resources, but what is specific for you and the goals that you want to do. Some people want to return to running and go run a marathon. Some people just want to run around their house with their kids, and some people want to go for a walk and walking their dog. So we figure out what your goals are, and then we develop a plan to help you specifically get better faster, so that way it's not a year, 2 years postpartum, you're still having issues, or even longer postpartum, and it's something that you feel like you have to live with the rest of your life, and that's not true.
Right. And I don't know how many people that they think it's just part of life, and it's funny when you sneeze and a little urine leaks out, or run or laugh. I mean, I've known women that never had children, they're in their 20s, and that happens too. But they think it's because their mom had the same thing and their grandmother had the same thing. Is that true?
So Yes, so it's not hereditary. So
Okay.
that bladder leaking isn't something that comes just because your mom and your grandma has it or your sister has it. It's specifically to your pelvic floor. So we find that a lot of women who are in their 20s that haven't had any babies, but they're actually really active. So they're runners, they're lifters, they do CrossFit, gymnastics, any type of higher activity exercises, the pelvic floor needs to respond to that, and so it gets really tight. And so then giving the treatment of doing a Kegel would make their symptoms, it would make their symptoms worse. And so they look on, they think they do the Kegels, and they're not doing, one, most women don't do Kegels right. Two, most women don't need Kegels. And so we look to see in those women who don't have any kids but are having those symptoms, there's better options than just being put on medication, doing a Kegel, or risk of having a hysterectomy, because that seems to be what people are doing for bladder leaking. But we can definitely help with it, get relaxation within the full pelvic floor, retrain breathing, looking at core, back strength, hip strength, just to make sure that you're functioning the way that you need to and absorbing that force the way that it should, so you're not leaking.
So really, women of any age. What about children?
Yes.
Do you have children clients too?
So there are pediatric pelvic floor physical therapists.
Okay.
Theirs is a little bit different because usually they see them a little bit earlier. So around like 2 years up to maybe 5, 6, 7, 8 years if they're still having incontinence at night, if they can't hold their bladder through the night, if they're having fecal incontinence, constipation, pain. They're really specialized in that population. But at the Fit Pelvis, we mostly see early, young 20s, and then all the way up to as old as, I've seen women up to 70 years old, 80 years old, and so we can help everybody in between. So there are really good pelvic floor physical therapists who help with the kids, but that's just not something that we do here.
They specialize in children, basically,
Yeah.
which, I was a pediatric nurse, so I understand that concept.
Yep.
What about women who are childbearing age when they are before they get pregnant or during pregnancy? Are there things that you can, when you're pregnant, you have a lot of different discomforts and sometimes actual pain. I was in college with one of my pregnancies, and I was studying in a study group on the ground, and I went to get up and my right leg wouldn't work. I couldn't put weight on it. And I went to the doctor, and he was like, I can't give you anything. I said, no, I don't want anything. I want to make sure my hip wasn't broken. I know. I was a nursing student too. But it just turned out it was a pinched nerve, right? But, and it went away when I had the baby. But do you help with those kind of things too?
Yeah, so if somebody is pregnant and they're having back pain, hip pain, pubic pain, shoulder pain, any other pain, we can help them. So that way you can enjoy your pregnancy and not be in too much discomfort. And then it's really exciting because I work with women throughout their pregnancy, and they come to me right at the end of their first trimester, and then as they're transitioning into their third trimester, they don't have any pain, and they're like, I have friends who haven't been to pelvic floor physical therapy, and they're in their third trimester and they can barely walk, and they have pain with turning in bed, and then my patients are able to fully exercise and walk and participate in all work activities without any pain. So it's not something that you just have to live with because it's common. People think like normal, common pregnancy symptoms, but pain should not be one of them. There's something that we can help with. So yes, looking at hip strength, glute strength, looking at nerves to see if there's a nerve that is pinched, giving you mobility, making sure that we're doing still core exercises so we can limit the risk of diastasis. And then we also help with preparing for birth. So traditionally, what is found to give birth is right when your water breaks, so you start having contractions, you go right to the hospital, they give you an epidural, you lay on your back. But we know that laying on your back is a way to slow down the progression of labor, and so we help you give the tools of trying to labor as long as possible, staying upright. What are the positions and exercises, movements where your pelvic floor feels the most relaxed to help with the progression of of dilation, what are some different positions that you can actually birth in, and then we work through pushing coordination. So a lot of times if you just look at the movies, people hold their breath and they push down really hard, but that's not the way to push. You have to connect with your pelvic floor and breathing, and so that's when we give you that specific individualized help to help during pregnancy, and then even reducing any risk of perineal tearing as well. So we help a lot to support. Yes.
Yeah. I bet do they ask you to come to their birth with them?
I haven't yet. But we do see women as early as 2 weeks postpartum.
Okay.
Because also traditionally you give birth, you may see your OBGYN a couple days after, and then you see them at 6 weeks postpartum.
Right.
And there's a lot that happens in between that time, and you could be having pain. You could have had a C-section. Now you have back pain trying to lift up and carry your baby, shoulder pain from breastfeeding. And so we start seeing women as early as 2 weeks postpartum to give that support as you're healing, as you're still needing to be active. And you had 5 kids, and so you gave birth and still had to take care of others. And so it's even just helping with people who have had multiple children and who may be needing some of the help. Maybe after their first birth, they didn't have symptoms. Maybe after their second and their third, now they're starting to have symptoms of pelvic pressure, bladder leaking, pain. So we can help regardless of what pregnancy it is, regardless of how early postpartum you are, we can help that way.
Yeah. It's real common for someone to say, if I felt like this with my first one, I wouldn't have had another one.
Yes.
Yep. Because all of a sudden it just hits them.
Yes.
That, I feel worn out, I'm tired, I'm sore, everything hurts. It hurts to stand up, it hurts to sit down, everything hurts.
Yes, and that's when you come see us, so that way you don't have to. And then we even just help you get back into exercising and then feeling strong, so that way when you do want to have another baby, your body is healed and is prepared for the second, for the third, so that way you're not feeling like you're still healing from the first and then going in and having to go through the second one. So we help you with that in between.
Wow. Okay, so all these people you can help. Does insurance cover your services?
So
how does that work?
Insurance covers limited services with pelvic floor PT. Okay. There are some places, not in Sherman, but there are some places that are a little bit further that do take insurance for pelvic floor physical therapy, but usually there you're seeing the PT for maybe 15 minutes, maybe 30 minutes depending on the place, and then you do your exercises with a PTA or a tech or somebody, and you may share your time within other therapists, other patients. But what we do here at the Fit Pelvis is we don't go through insurance because we don't want to be limited to one body part.
Right.
So we are skilled and specialized to treat the whole body from head to toe. So you could be coming in for shoulder pain, back pain, pelvic pain, and we can treat it all. If you go through insurance, you typically are limited to one body part. Right. So if you have shoulder pain, you can only treat shoulder before having to go back, getting another referral for something else. Okay. But we have that freedom to use our full hour. So every session is one-on-one, every session is an hour, and we can treat every concern that you have. And we truly know that the body is all connected, so you actually get better faster because you have that skilled one-on-one eye to make sure you're doing the exercises correctly. We can progress quickly, so if I give you an exercise, you do really well with it, and I need to make it a little harder, then we can do that in that moment instead of waiting until the next time. You're confident that you're doing the exercises correctly, and so it is shown that people who go out of pocket can get better faster. We do take HSA cards, FSA, we take care credit, and we provide super bills for people to take to their insurance for possible reimbursement. So we try to make it as accessible as possible as we can, but then allowing us the freedom to treat in the way that we believe people deserve.
Right. Nice. Okay, I don't know if you want to answer this question. Is it expensive for a session?
It depends on what is expensive to you. If you find the value of taking care of your body and you want to invest into that, then no. I mean, you put your money where you value, and so it's not expensive if you want to take care of your body. And then if you're going to multiple PT sessions, multiple doctor's offices and not getting an answer, they're putting you on medication, you do exercises, but you don't know if you're doing them right, then you're putting money in something that's not high quality. Right. So we provide that high quality care. We also offer session packages. So if you have,
that's a good thing.
Yep. So if you have, depending on how many sessions that you need, we also can discount those sessions and create a package, and then we have flexible payment plans too.
Okay. Yeah. Well, what have we not talked about that I didn't ask you that you might want to share? Something. How do we contact you besides even if we're getting a doctor's referral, we still need to know how to contact you, right?
Yes. So you can go onto our website at thefitpelvis.com and you can fill out an inquiry form and you can chat with a physical therapist. It's a free consultation call where we can talk about what are your symptoms. We can share a little bit more about what we do in our sessions, what they look like, what's specific for you, and then just seeing if we're a good fit for you, and if we need to send you somewhere else, then we can give that option, or we can get you scheduled right within that consultation call.
Wow. And am I talking to a person or a bot?
You're always talking to a person.
Okay. Sometimes it's hard to tell.
Yes, that's true.
It is hard to tell until they say something off. Then you're like, wait.
You didn't answer my question.
I
yes.
know.
Okay.
I already answered that question, or yeah, you didn't answer my question. Okay. And I'm not saying anything's wrong with the AI. I just wondered. Some people, they don't want to call if they're going to be talking to a bot.
Yes.
They want to talk to a person that can hear them and answer their questions.
Yes.
Okay. Where are you located?
So we have 4 locations. We have McKinney, we have Sherman location, Prosper, and Dallas.
Wow. That's amazing. So really anywhere in the Metroplex could pretty much
all the way up and down 75.
Yes.
Across 380. Yes, and then I treat at the Sherman and the McKinney location, and then we have other therapists who split their time between McKinney and Prosper and Dallas.
Okay. And then the consultation, is that with the phone number or is that through online too?
Yeah, so you can fill out the form online, or you can either call or text our clinic number as well, and you will talk to a real person to get you scheduled. So they will offer you a couple times that any one of the 4 physical therapists have available to chat, and then you would talk to one of us and we can hear about your symptoms, what's going on, what you're looking at, and then get you scheduled from there. So, yes.
Okay. That's really exciting. Like, I feel happy knowing that women have these options.
Yes.
Because for hundreds probably of years, we've thought that we just had to struggle as part of the different phases of our life.
Yes. Right. Yes, that is one of the biggest pieces that led me into this field and that I'm really passionate about, is that women, we no longer have to suffer in silence. You don't have to be embarrassed because you cough and sneeze and leak, and you don't have to cross your legs. You don't have to live with back pain. You don't have to live with hip pain or feeling of pelvic pressure, pain with intercourse, or just any other pain, because we help treat the whole body. So yes, just knowing that we have the tools to help educate women and help women feel really good and strong, and that they can do all the things that they want to do. If they want to run, if they want to jump, if they want to laugh, if exercise, lift, pick up their grandkids, pick up their babies, then we can help you in that with any of your symptoms. And yeah, we don't have to be suffering, and pelvic pain, period pain is just not normal. It's common, but it's not something that we have to live with.
Yeah, period pain. I mean, I've never suffered with it, but I had friends that literally were in bed for 2 or 3 days because they were in so much pain. And I'm sympathetic and empathetic and all those good things, but I never, what do you do? Like,
yes.
It just feels like, what do? You take something orally for pain, or, just try and rest. So this is neat that there's actually a way for people to help their bodies so they don't have to suffer through that.
Right. Yep. That's what we do. We're here to help.
Okay. Thank you.
Thank you.
I've enjoyed meeting you.
Yes. Same.
and you can probably tell she's sweet, bubbly, kind, empathetic, and would be a great resource for anybody that's in the Sherman or McKinney area. And then I'm sure there's others just like you.
Yes.
So that work in the other areas. And if you're not in this location at all, then Google.
Yes.
Are there Fit Pelvises in other states, or is this just a
Nope, it's
regional
locally
thing?
owned, it's
Okay.
women owned, so we started it in 2020 during the pandemic, and we
Okay.
just continued to grow really fast and opened up our other locations, but it's just a small team of us, and we work really hard to provide the best quality of care. We're very mindful about not just growing really fast and just to grow to say that we have all of these locations,
Right.
but we want to make sure that in our growth that every therapist that you see is very high quality, and just making sure that you deserve the best care possible. So whichever location, whichever therapist you see, we have made sure that it is really good and you're going to receive really great care.
Okay. Well, thank you.
Thank you.